Alfred Health has been extremely supportive of me from the beginning of my time here.
There were people from quite different aspects of the organisation, including other external overseas visitors that have worked here for a long period of time, and including those that have worked very much beside Libby, but both nursing and medical, but also those that won't have worked with Libby as much in the organisational hierarchy, if you like, or the administration, all without any direct questioning from us, were very enthusiastic about her role. And I think it was spontaneous, it was very affirming, and they said that the project, which is largely about Libby White being here, and her activities, has been a great success.
My name's Libby White. I'm an emergency nurse mentor at the Emergency Medicine Department at Muhimbili National Hospital in Salaam in Tanzania. I've been here for about 18 months and initially came on a 1-year contract, but now I've enjoyed my time here so much we've extended it to a 2-year contract. Before that I was working as an emergency nurse unit manager in the emergency department at Alfred Hospital. My first impression when I came here was how incredibly warm and welcoming the people are. Tanzanian people are very interactive, and they're inquisitive, and they want to talk to you and ask you about yourself and what's going on in your life and why you're here, and they're very, just very welcoming. They have developed emergency care in 7 years, now 8 years, and so they've come from nothing, but they've come from seeing a patient, maybe taking their blood pressure, and then if they have abdominal pain, sending them to a surgical ward, to now bringing that patient in and taking a full set of vital signs, doing a full assessment of that patient, including blood tests, other like investigations, clinical assessment, and then actually forming a complete diagnosis for the patient, referring them to the correct unit, and then transporting that patient. So in 8 years, they've gone from nothing, having no education or expertise in emergency whatsoever. It wasn't even really a word, it was called the casualty department, to now having fully trained specialised nurses and doctors that can provide a level of care that you could take them out of this environment and put them in at the Alfred and they would fly. It's incredible. The nurses especially have a good knowledge base, but translating that into practice has been a challenge, and they don't have the staff numbers or the time to be able to give that clinical bedside mentoring. So that's one really important thing that I've found was needed, and also that I've really enjoyed doing, because I can see those small changes every day, and that the nurses enjoying knowing what they're doing, why they're doing it, and being able to translate. And also from the leadership side, working with the leadership team, because they are a very young leadership team, to try to solve some problems and suggest some solutions that we can adapt from my experience into this situation. And it's not a one-size-fits-all kind of solution, because the challenges here are very different. So working with all the members of the leadership team, including procurement, supplies, quality improvement, the biomedical engineers, and trying to figure out what everyone's challenges are, so we can find good ways of communicating the issues to each other and finding solutions to the problems together. The frustrating thing now is that the emergency department is working so well that the challenge is how to continue the care for that patient throughout the hospital, because they haven't kept up with the level of training and the pace that the emergency department has gone with. So some of the things that would be valuable in a Western country or a developed country that they could take from this country that still is developing include resources. So when resources are scarce, we reuse things here, and I feel like before, or in other health systems, there's a lot of waste. We just throw things out without really thinking about it, and there's a huge amount of waste generated because of that. Another great thing that the Tanzanians have implemented is to encourage relatives to go and donate blood. So if they have a patient that needs a blood transfusion, the families are asked to go to the blood bank, which is directly opposite the emergency department and very close to the rest of the hospital. They're asked to go and donate blood. Now their blood obviously doesn't go directly to their patient, but that still keeps that flow, so that idea of demand and supply keeps going. Also, there's an amazing sense of community here. So the Tanzanians as a people all support each other and look out for each other. So I think maybe we are starting to lose that a little bit because we feel like our lives are so busy and important, but the Tanzanians haven't lost sight of that yet. So they very much look after each other, and if someone's in need, they will go and support that person or provide assistance in whatever way they can, even if it's very small. What I love about working here at Muhimbili is the people. The Tanzanian people are very fun, they're very lively, they like joking, but they also like to learn. They're very aware of how important education is, and if they have the opportunity to learn new things, they really soak it up. I love the way that they talk a lot about the problems that are going on, and they try to find solutions, and they are so creative with their solutions because they don't have much resource-wise, but they make things out of nothing and create these amazing solutions. The way that they find solutions is for connectors. They cut up other pieces of equipment to make connectors so that tubings will fit together. Catheter bag tubing as suction tubing if we run out of it. They just think outside the square of what we have and how can we adapt it to what we need right now, today, for this patient. A visit like this from the Alfred team to come and visit Muhimbili National Hospital just shows an extra level of support and encouragement, and helps to continue with the development here. As I said, the team's very young and the leaders have been created, they've just graduated, and then they've been the experts in their field, and so then they're the leaders. So those people need also we have to remember that they need mentoring and support and encouragement to be able to go to the next level. And because of the challenges that are faced here and the busyness and the acuity, sometimes they just carry on doing what they're doing. So for the Alfred team to come here and provide this leadership course has really helped the nurses especially and the other attendees to gain new ways of looking at things and new ways to add into their already incredible portfolio of problem solving capabilities. They're a small and young team with a lot of great big ideas of spreading emergency medicine around the country. I guess the challenge from that perspective is burnout and people working too hard because they really believe in this thing we call emergency care and they want it to work. So I think that's one of the biggest challenges. A small group of really smart people trying to do all of these amazing things. I'm proud of the team here every single day. If you watch a patient interaction, a patient assessment, the treatment provided to the patients, the way the staff are thinking about how they are looking after each other, how they are being developed as leaders, every day there's little wins and little things that make me smile.